Are you puzzled by everything you hear about hormone replacement therapy and whether or not you should be on hormones and bioidentical hormones? Well, I'm puzzled by it too. And I got some answers today. This is Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer. And my guest today is Dr. Shilpa Sayana. And she helps people, women, deal with this stage of life when our hormones are all over the place. And what I really loved about what she talked about was that she's not all about just throwing hormones at you. She talks about three prongs and how we can help support our body so that maybe we don't even need to take hormones. So I'm really excited to share this episode with you. Really good. I think you're going to find it very informative and helpful. All right, I'll see you inside. Let's get started. Shilpa, I'm so excited to have you here for Wellness by Design today. Thanks so much for taking the time out of your busy practice to be here.
Thank you so much for having me, Jane. I really appreciate being here.
Well, the work that you do is so important to me and to women my age, perimenopausal, menopausal women. And I've got a lot of questions. I keep hearing about bioidentical hormones and should I be on them? Should I not be on them? So I'm really excited to get your insights today and to share that with the audience. But I always think, like, what brought you to this work? Why did you decide to hone in on women's health and especially perimenopausal, menopausal women's health?
Absolutely. I think story coming to integrative medicine for many of my colleagues is a personal one. So I am an internist, which means that I take care of adults above 18 to when they leave the earth. And I got trained in a very traditional model. It's very siloed. Like you have a urinary tract infection, you treat it and you get better. And in my early 30s, I was traveling globally, teaching other providers how to take care of an infectious disease. And I was traveling all the time. I had a young 18-month-old. I was a wife and a mother. And I had my own, I was working for another practice here. So it was such a busy time juggling all these balls. And at that time, I was diagnosed by having a mass in my neck. And it was like, whoa, what is this? Why did this even happen? No family history. And my regular medicine framework, they're like, this is coincidental, sporadic. We don't know why. And then I was like, well, and the treatment is we could take it out and you might lose function of your left arm. And thank goodness it turned out to be a benign tumor. But in that 10 days of waiting and just like biting my fingers as to what could this be? And is this something terminal? I realized how medicine, being on the other side of medicine, could be very lonely. And I was like, I really need to make sure that what I'm doing is always partnering with my patients so that they know, especially during times like this, that, I hear them and I understand them and that we're going to get through this together. So it was such an eye-opening experience. And at that time, I was kind of like, why? Well, why did I get this? But my conventional medicine training didn't give me any answers. And that's when I learned about functional medicine, which is trying about getting to the root cause, which is what was my stress level at that time? It was high. What
Yeah.
was my nutrient intake? Poor. What was my inflammation? Probably really high. And that was the canvas for why this happened. And that's when I discovered functional medicine and truly fell in love with it because it's changed my life, the life of my family, and those of all my patients. It's about the why. And if you can understand why things are happening, you're more likely to get a long-term improvement in symptoms and a reversal of diseases.
Mm. Functional medicine changed my life too, discovering it. And I think the other piece that's missing in the conventional is that looking at the whole person and not like a bunch of parts, right?
Completely. And that's what I explain that to my patients a lot. Like functional medicine is very triangular. You have genetics that you came in with, you have exposures that you were exposed to, and then you have stressful triggers. And we can switch on and off your genetics, but it depends on the other two parts. What were you exposed to? What's your stress perception? Did something stressful happen that activated your genetics? It's a much more holistic way of understanding where you are at this time.
And I think people know that too, like they sense that, like you did. The
Too.
same thing happened with me with, I had I had a stressful year and then I had rheumatoid arthritis. Like I knew
Exactly.
that there had to be a connection, right? Um,
And women know this,
yeah.
and people know this intuitively, but they go to the doctor, and the doctor's like, "Oh, I checked your labs, and everything's normal. Or come see me once a year, and you're not dying right now." But it's really like what's underneath, and what's the stuff that we're giving to the soil to feed your health, and
Hmm.
what is going on with the root causes that maybe have subacute or symptoms that you may not be even aware of. I have a slight headache. I have a little bit of bloating. You just kind of do, we tend to dismiss that, especially women, because we're so busy juggling.
Yes, yes.
Yeah.
So, you came into functional medicine because of your own health journey. I'm glad that everything worked out well.
Yes,
Um,
so am I.
and now you're specializing in women's health. And so,
Yes.
what is it about that that
Yeah.
is
So women, especially women in their 40s and 50s, all the way up to end of life, are truly the patients we generally see. And the research in women's health, especially around hormones and around perimenopause and menopause and what's happening during those transitions, is only coming out now. Like, it was such a limited amount of data that we had to work with. We scared all these women about hormones. The
yes.
generation, 2 generations above me, my generation, are pretty petrified to take hormones because they're like, oh, I'm going to get breast cancer. What's going to happen? But looking back at those studies, they weren't interpreted in the correct way. And what they were studying was more a synthetic hormone versus more of a bioidentical hormone. Another big part of functional medicine is, who are you putting these hormones into? What's their inflammation burden? But why I kind of really hone down on women is because there's a lot of inflammation that's happening in your 40s and 50s. And that's what functional medicine is really good at reducing. And if you could improve the inflammation, then you can tolerate things like hormones. You may not have a very intense perimenopause to menopause transition. It could go very gracefully, and you could be easily on the other side and say, oh, what was that?
Mm. So, what are some of those factors then that can shift it to be easy or difficult?
So the biggest one I would say would be your stress perception. So if
Mm.
you already have many, many roles, kind of like myself in my 30s, where you're juggling many things in your life where you're constantly in this stress state. So what that does is, genetically, we're not wired to be this busy and have in a life this full of intense demands.
Mm.
And our body is, when we're chased by a tiger, we increase our cortisol, and our bodies like keep running, keep running. In that scenario, you either get killed or you get saved. And that's how our ancestors were. But the same genetics still exist. And for us, is, if you have to drop your kids at school, you're taking care of an aging mom, you have a big presentation at work, all these constant pressures in our life put our body in this high cortisol state. And cortisol is a stress hormone from two tiny glands on top of your kidneys called the adrenal glands.
Mhm.
And if you're constantly in this high cortisol state, you tend to eat up other hormones. And the first hormone you eat up is progesterone. And progesterone is a fertility hormone, but if you're running from the tiger, you're not thinking about fertility, you're thinking about surviving. And
Exactly.
so cortisol is the main hormone. And that's really your wheelhouse. How do you really regulate cortisol? And once your cortisol is out of control, it's going to eat up progesterone and push you into early perimenopause. And we see women entering this as early as 37.
Wow. Wow. I saw this in my own journey as well. So this stressful year
Yeah.
happened right, from 49 to 50. As soon as
Mhm.
I hit 50 then and I got this rheumatoid arthritis, then I also hit menopause, like it just came on
Yeah.
suddenly. So many things happening at once, totally related to stress that I could see. So,
For sure. So stress is a big pillar that needs to be
yeah.
addressed. And I would say if you had to think about it in four different pillars, the first one being hormones, and
Mhm.
under hormones, like cortisol being one, thyroid being another one, insulin, what's happening to those hormones in this age decade or your 40s and 50s. And once your cortisol goes high, you need blood sugar to keep running from the tiger. Your insulin goes high. When your insulin is high, it drops your testosterone. So as you're aging, you already have maybe less and less testosterone, but that just gets worse if you're also stressed. The second big pillar we look at is your gut health. And the gut's really the key in functional medicine is what's your gut microbiome, but what's your gut lining? The
Yeah.
third pillar we look at is toxic burden. And what are those toxins you have in your system that may be impacting your hormone assimilation? And then the last thing we look at is your lifestyle. So all of those pillars is how we look as to someone to see, are you a good candidate for hormones? It surprises a lot of our patients that the one test we have everybody do if they're considering hormones is a gut test.
Right. So what is the gut test? What are you
Yeah.
testing with that?
So we're testing for your gut microbiome. There's a
Mm-hmm.
common condition called SIBO, SIBO, small
I've had
intestinal bacterial overgrowth. And if you have SIBO, I've had it a few times, but if you've had that, it does impact your ability to process estrogen.
that.
So, for example, one of our recent patients, she has genetics that she came in with, part of the triangle, that doesn't let her process estrogen well. And she also had SIBO. She had traveled recently to Mexico, had a stomach bug, and developed SIBO. And that also inhibits your processing of estrogen. And her gynecologist, seeing that she was in perimenopause, menopause, gave her some estrogen, which made her bananas. She was like, I couldn't sleep. I was really anxious. And the problem is they just didn't look at the whole set of who she is as a person. What's
Mm-hmm.
the information? What's her gut? What's her genetics? And is this the right time for estrogen before kind of cleaning out that foundation?
Mm-hmm. I know people. I was having this conversation with some other ladies recently, and I have not taken any hormone replacement therapy, and I tend to shy away because I sort of feel like I don't want to interfere with my body too much. Yet, and these are all women that are in the natural wellness space, and they were saying, no, you got to do it. You'll feel so much better. So I was convinced, okay, I better do it. But I still sort of feel some hesitation. So how
I
would you
think that's
handle
okay.
someone like me?
Yeah, I would say you're like 40% of our patients. And
Okay.
you know what? I am not ready. Like I haven't taken it in my late 40s. Is it concerning to take it later? And there's so many natural solutions you can do to impact your hormones. And I think it's so important to understand the hormones in its umbrella category. Because if you think of the sex hormones, estrogen, progesterone, testosterone, they're a very small part of your hormone bucket. An analogy I like to use is think of the adrenals, your stress hormones, where they come from, the gland as the grandmother. And then think of the thyroid as the mom and think of the ovaries as the grandchild. And in a
Uh-huh.
conventional medicine, we're good about giving you hormones. Maybe we'll give you birth control or bioidentical, or I mean, some sort of hormones. We may check your thyroid, but we hardly look upstream what's happening with your adrenals. And if we really focus on your adrenals and improve your cortisol, stress perception, inflammation, whatever's draining that, you will notice that both mom and granddaughter will follow suit. And your hormones suddenly start to appear and you can just give them natural support and they may not even need hormones. That
That
being
makes a lot
said,
of sense to me.
good, I'm glad. And I think when I explain that to my patients, they're like, okay. And sometimes you can support them and they're like, you know what? I'm working out really hard. I'm trying to build muscle and it's just impossible. That's maybe a time to think of maybe first supplements to increase testosterone. Things like fenugreek work really well, like high dose fenugreek to really increase your body's production of testosterone, or thinking about a tiny dose of topical testosterone. But a lot of women get scared. They're like, are you trying to make me into a man?
Yeah, I know. I don't want to grow a mustache.
Exactly. No, not at all. And just so you really understand the doses. For our male patients, we're giving them 200 milligrams. And for our female patients, it's between 1 and 10 milligrams. So it's super tiny and it can make a world of difference. And the big thing with testosterone is it's a very anti-inflammatory hormone. So of all the other hormones, it really does help with inflammation. So a lot of times they're like, oh, my shoulder pain is better, or my joint pains are better. And the other hormones do help with your elasticity. Because when you're going to perimenopause, menopause, your ligaments are very stiff. So it's
Mhm.
easy to injure yourself. But if you have optimized some of these hormones, you can easily work on building muscle. And muscle building is so important, especially in these next 2 or 3 decades.
Hmm. You said something that kind of surprised me. I didn't realize that you could take herbal
Yeah.
supplements to change hormones. Um,
Yes.
so you mentioned fenugreek helps
Yes.
increase testosterone.
Testosterone.
And what are some of the others?
Yeah, so I would say we have a lot of patients, women who come to us in our 30s, 40s, and 50s, and you can understand how we blend in natural supplements because our goal in our practice is to try and use lifestyle first, supplements next, medications if needed at the tiniest doses. So
Mm,
with the lifestyle piece, it's all about sleep, nutrition, and movement and stress perception. With the supplement piece, people, women in their 30s who have maybe have kids, a job, already juggling, and they start having their periods becoming really heavy, or they have something called polycystic ovarian syndrome, and you already can tell that their progesterone is getting lower and lower. In those cases, we give women chasteberry Vitex. And we have a supplement here called Cycle Support. It has chasteberry, B6, and magnesium, all these natural things that increase progesterone. And I use that supplement all the way till women in their 50s. And sometimes people just taking the supplement are like, I feel better. I feel like my mood's a little better. My sleep is a little better. So you don't have to jump to hormones right away. The
mm,
second supplement we do use a lot is for hot flashes. So common for many of our patients. And we use Siberian rhubarb, and that's an analog to estrogen. So we use that. It doesn't show up in the labs as it should. Like if you, it's not the same as taking hormones, but a lot of times we can get people's symptoms to get better. And with the testosterone, like the fenugreek, we really do expect to see it in the blood. And we do expect the patient to say, you know what, I actually feel better with energy, with libido, with muscle making capacity, and with memory. So those are the things we can use a lot of natural supplements. The only thing is that there are a lot of pills. And as we go into perimenopause, menopause, our likelihood of getting acid reflux is much higher. And when you're taking all these pills, some patients are like, I can feel them, and you can have pill esophagitis. So with the hormones, it's just easier because it's a patch or a cream or one pill, but that's really meeting the patient where they're at. And
mhm,
another big thing in this whole perimenopause, menopause journey, like you had, is women are 4 times likely to get an autoimmune condition.
mhm,
When we do provide them that support and the scaffolding with improving inflammation, gut health support, and hormones, we generally see those autoimmune markers at least go into remission.
mhm. Well, that makes a lot of sense. But I love that approach, Shilpa, where you start with lifestyle, then natural, then maybe the more medication kind of thing, or the bioidentical.
Yeah.
So, can people, should someone just like go to their supplement store and buy something, or like,
Yeah, I
are there
would say
dangers of taking
yes.
any of these?
They are. So what you could do is if, and I'll give you our website. We have some hormonal quizzes because people are like, am I high estrogen? Am I high progesterone? Am I low testosterone? And it's confusing because all those symptoms can bleed into each other. So there's some quizzes on our website you can take, which will kind of tell you, are you estrogen dominant? You have low progesterone, just based on symptoms. And you can say, oh, based on these symptoms, I could try these natural supplements that would increase my estrogen or my progesterone or my testosterone. I would say the most important thing is to work with someone because it's not just the granddaughter, right? It's like what's happening with your thyroid, what's happening with your adrenals, and how do they all work together. So if you could ask your doctor for, can I have my cortisol checked? Can I have my full thyroid panel checked? Like as an internist, we check 2 labs. As a functional medicine doctor, we check 5 labs for the thyroid. Like ask your provider to really partner with you. And if they're not going to partner with you, find a new one and work with them. Say, okay, what's my thyroid? What's my thyroid? What are my adrenals? What are my sex hormones? The one protein that I would make a big plug for checking when you're working with your doctor is something called sex hormone binding globulin.
Hmm.
SHBB. And this is a protein where a lot of times patients come to us on hormones and they're like, I don't feel good. It doesn't matter. It doesn't matter how much I take, nothing works. And what we do is when we check the lab work, we find that this one protein is really high, and the protein's function is to bind all your available hormone. So a woman may come in on some testosterone and she's like, I don't feel it. But if you check her total number, it's quite high, but so is this protein. And the ways to reduce the protein is by working on your gut health, reducing toxic burden, improving inflammation. And then she's like, whoa, I feel like I'm on too much testosterone. And then you can dial it down to the
Mm,
dose she can feel. So there
mm,
are so many options. But I'd say for your listeners, working with a practitioner who's willing to check their hormones. I think working in the blind is kind of hard, working in the dark. You're kind of blindsided as to what exactly are your hormones, and they're easy to check. They shouldn't be a complicated thing, and it's quite easy to learn what optimal should be.
mm-hmm. And is there a difference when you're approaching this from a functional medicine perspective compared to a conventional perspective? Lots of times we hear in conventional, oh, it's normal when, we know it's like if you're leaning that way, it's definitely not. It's common,
Yeah.
but not normal. Is that similar? Now, you mentioned that you do extra tests, but is there anything about the test results that's different?
So first of all, a lot of my patients get super frustrated that their conventional primary care doctor refuses to even check. And
Mm,
they're like, I'm not going to check your hormones. That's not necessary. This is like a normal thing you're going through. I would, instead of checking your hormones, I can just give you the hormones. And and patients insist, they'll just check their hormones and they'll say, oh, it's normal because it's within range.
mhm.
The biggest difference between conventional medicine and functional medicine is it may be within range, but is it optimal? And
Right.
that's what we're really shooting for. If it's and patients are like, well, how do I know? What's the magic number? There's no real magic sauce to it. If it's a good thing like vitamin D or vitamin B12, you want it to be in the top quartile of normal. It's really good. And for example, vitamin D is a good example. Normal is between 30 to 100. As a conventional internist, I'd say it's 29, it's normal. But I do know as a functional medicine doctor, as an obesity medicine doctor, it needs to be above 70. Like I like it around 60 to 70 because I know if that's optimized, you'll feel better with energy, with your immune system, with sleep. So it's really about the same labs, but if it's good, is it optimal? If it's bad, like inflammation, is it undetectable?
Right. I think we want to be optimal, right?
We absolutely did. And I think so many women were never given the option. And it should be and that's why I really like this concept about medicine 3.0. Like medicine 1.0 was, the doctor decides everything and tells you what to do. And then medicine 2.0 was big pharmaceutical companies that came in and said, these are the medications you should take, and only it's about medications. And medicine 3.0 is really this concept about partnership. Like you know your body best. You know what's going to work for it. You need to be in the driver's seat, but you need to partner with people who are going to be guides, like your GPS, and say, take a right. If you take a left, you may not be going the right direction. But look for doctors and practices that are willing to see you in a medicine 3.0 fashion.
I wish I could come to your office.
Come on
So I
over.
may just do that. So tell me about how you work because you tell me about your practice.
Yeah. So we how we work is we offer the three different ways to work with us. One, first of all, I'm based in California and I'm only licensed in California. So if you are outside of the state of California, we need to see you one time in person, just to kind of establish care. And then for the entire year, we can treat you as online, just to telemedicine appointments. And then you'd have to come back once a year, come visit sunny California and come pay me a visit.
Mm,
But after that, you could either come and do a lab consult, is where you just come and I just want to know the lab work. So we do hormonal lab work, we do the gut testing, and we do the longevity labs, so it's like the autoimmune stuff, inflammation. And when we get those labs checked, we'll come up with a report of findings and explain that to you. Or you can do programs. So that's pretty much the primary way we work is either a 4-month, 6-month program, and you can stay with us for membership. Most of our patients are women in perimenopause, menopause, and their husbands. But they're really trying to really up level their health and work with someone closely who understands the whole person. So, and yeah, programs and memberships, it's easy to work with us, but it's most important for you to be ready because functional medicine does have a lot of data, information, and we do ask for you to change lives, might ask you to change your lifestyle.
It's true. And people are, I think more people are coming around to that now, but we had this whole many years, as you said, where we think all we got to do is take a pill and
Yeah,
everything will be fixed and I don't have to change anything that I'm doing. But
exactly.
we know that lifestyle impacts our health. I
It
mean,
really
just for
does.
example, I know that if I drink wine, I will have hot flashes. It just
Yes, exactly.
so I if I don't want hot flashes, I have to that's a decision I make, right? I don't drink wine
Exactly.
and I don't have them. So,
Exactly. And that's, yeah, and that's important to know. And, above 40, our blood-brain barrier is thinner. We're more sensitive to toxins like alcohol. Or
mhm.
you could take some like NAC, N-acetylcysteine, or the wine drops before you drink something, and that will reduce your side effects. But it's one more thing to do that you didn't have to do in your 30s.
Yes. Yeah. Well, it is a natural process, but we're living longer now as well. And so, if you kind of think about nature, once we have our children, do
You're
we
kind of
really
done.
need to be around? But we want to be
Oh,
around. We want to
yes.
be around and enjoy life. And so, what,
And that's exactly it. We are done. And a lot of patients who come see me who are like on the fence about hormones are like, my mom had a knee replacement, had a hip replacement, has severe osteoporosis. I don't want to do that. That was natural. And I was like, well, if you want some testosterone, it probably could help your bone health, do a lot more resistance training, manage your stress. That is another pathway. And then just GPS telling you if you try this path, you might land up in a different place than her.
hmm So what would you say to someone that is on the fence about hormone replacement therapy?
I would say check your hormones and see where you are. And I would say the biggest thing I caution people against is doing all the hormones at once, which is how we train in conventional medicine. It's like, here's your progesterone, here's your estrogen, and we give the same dose to every woman. Each of us are different epigenetically. It's like, what are your genetics? What's your trauma? What's your lifestyle? What is the stuff you were exposed to? So each one of us is unique. So it has to be, what are your hormones now in this point? And do you need hormone replacement? Which is what symptom bothers you the most? Is it sleep? And if it's sleep, then maybe it's a high cortisol or a low progesterone. If it's hot flashes, maybe it's a high cortisol or a low estrogen. If is it I can't make muscle and I just can't find the word, it's at the tip of my tongue, it's just not coming, then is it testosterone? And I would say focus one at a time on the hormone that you're most deficient in rather than doing the whole kitchen sink, because that's where if you have a side effect, you don't know which one it is.
Mm-hmm.
And so start natural, start with supplements, and start with the lowest dose of a hormone if you need it.
And how long would it take someone to notice if they were experimenting and they're going to try
Yes.
some supplements? How long before they would start to
Good
see a change?
question. So with a supplement, I would give it 6 weeks. And six
Okay.
weeks, you're not noticing too much. Increase the dose of the supplement or stop in 3 months because you're not noticing it. And sometimes patients come to me with zero estrogen, zero progesterone, zero testosterone. And I just saw this patient the other day. She's only 51. And she's like, I went to my doctor and they put me on Prozac. I mean, that is the endocrinology guidelines, in perimenopause, menopause, it's an SSRI, but this is not a deficiency of Prozac. For her, it's a deficiency of progesterone. So we put her on progesterone and she's like, oh my God, I think I have myself back. Like I didn't realize that sleep could be so delicious. I'm scared because, sleep is very much associated with memory. So if we're not consolidated in our sleep and getting at least 5 to 6 hours of uninterrupted sleep, we're at a higher risk of memory issues in the future. So
Mm,
I would say, yeah, see what your hormone deficiency most is and what your symptom is. So that would be progesterone, and then estrogen could be like I have a lot of skin elasticity issues, or I have issues with memory. And estrogen receptors are not just in the ovaries; they're all over our bodies. And the problem is, we only started including women in research in the 1970s because they were too complicated.
crazy.
It's crazy. And, because they were too complicated, they had hormones that went everywhere. And we are more than 50% of the population, but let's not include them. And so this research only came recently. And in terms of menopause, perimenopause, that research is happening now. And even still, it's not a main priority. So once we have more research, we'll understand it better. But a lot of it is extrapolating the data for men, as well as trying to guess. But at least you have your hormones. We do know what goal hormone should be in the perimenopause, menopause stage. And then the other thing is there are some medications. Let's say you or your listeners just don't want medications. You can try some good supplements that have good ingredients like chasteberry vitex, Siberian rhubarb, fenugreek. But when you're doing these big blends, you might have a side effect. So my big goal is try one supplement with one main ingredient at a time and see how you feel. Because you might be genetically someone who feels things very deeply. And the supplements, even though it's a supplement and you think it's like safe or low dose, it could have powerful side effects. So
Mhm.
working with someone would be my first recommendation, but that's not possible. You can try playing around with these supplements, but just make sure you are monitoring.
Yeah. I find with a lot of the people with chronic pain, they're already sensitive, right? Because their body's already put up this protection.
Yes.
So they tend to be sensitive to a lot of things. So when I hear like about supplements, happy hormone supplement, whatever it is, I think, oh, I don't like, what is it? So I love what you're saying there. Like come back to the basics and do one at a
Yes.
time, experiment on yourself. But getting the picture would be the picture of where you are now is really good. So is there anything I'm definitely going to be listening to this again and taking notes.
Good. I'm glad. Yeah.
Shilpa, is there anything that we haven't covered that you really want to make sure the audience hears?
I would say for those, some of my patients come in with like a suitcase full of supplements, and they're like, I'm taking all these supplements and I'm so scared to stop them because how about if I feel worse? I would just caution that because they all have to go through the liver and they all have to be processed. A recent story just with a patient of mine who had very, very low platelets, which is an important part of your bone marrow that helps you clot. It's in your blood and helps you clot. But her low platelets were low, and she had a bone marrow biopsy. She was seeing a cancer specialist, and they're like, "Oh, they haven't figured that out." And she was also in this perimenopause menopause journey. And I saw her list of supplements, and she was on mega high doses of green tea extract for aging healthy. Green tea as a natural supplement can suppress your platelet production. So we stopped the green tea, her platelets went up. She didn't have an issue, but it was something that was self-created. So I'm a big proponent of supplements, but I must caution your listeners that make sure you're taking it with some supervision and don't think it's so benign.
Mm, such sage advice. Thank you for that.
You're so
Uh,
welcome.
so one, this show is all about intentional living, being very, consciously being the creator of your life, wellness by
I
design.
love it.
So what would you say is a baby step that someone could take today that's going to begin to initiate healing in their body? Whether it's hormones or anything, what would you
I would
suggest,
say
Shilpa?
a big thing that I find is stretching. So stretching by itself reduces your inflammation markers and cytokines markedly. So if you could do some sort of 5 to 5 minutes, 5 to 10 minutes of stretching could really change your trajectory. Because as you're in perimenopause, menopause, you are in a pro-inflammatory state. You just are. Because you're lacking hormones, you have more inflammation, you have higher stress levels. So I'd say stretching. If you could do something that's 5 to 10 minutes of just simple stretching daily, and then my second biggest hack, I know you didn't ask for two, will be meditation. Like 20 minutes of some sort of meditation just to get your day started. I've seen those two things be incredibly transformative for people.
I'm so glad I'm doing my yoga and meditation every morning. I got
Excellent.
those ones. I have not had anyone mention stretching before.
Okay, good. I'm glad.
Yeah, that's a really, really interesting. And I know that I feel better from stretching, but I didn't
Yes.
realize that it brought down inflammation. So that's
Yes,
really
it really
interesting.
does. You just have to
Mm,
do it and consistency when you
yeah.
stretch. Yes, but we
Okay.
got it. We can do it.
We're going to put some links in the
Yeah,
show notes here. So can you talk about what they are? You mentioned a
sure.
couple of things. Yeah.
So one is you could do something called a hormone insight, which is you do the blood work ahead of time and you come and see us for the visit. So ideally you live in California or you come here or you do the blood work ahead of time and you plan to visit us and we can go through that. And then the second thing is the a discovery call. Let's say you just want to come and talk to us about how to work with us more long term. And then the last thing is my favorite gentle detox supplement. And it's something called Cortisol. It's just 7 days. And toxins are ubiquitous to our environment. And if genetically you don't detoxify well, the last thing you want to do is take hormones Or if you take natural hormones, natural supplements, they won't work because your liver is so busy with all these toxins. So it's a 7 day kind of a clean detox regimen that I find really works with a lot of people. And there's a 15% discount in the link that I'll make sure that I include.
Thank you so much. So basically, you would recommend doing that detox first before anything else.
Yes, completely. And for somebody who just doesn't, it's like, this is the bare minimum I can do the detox, work with your practitioner, and at least you know you'll go into there with a cleaner canvas than before.
I love that. Now, I got to ask this question because I'm in Canada. Some of my
Yeah,
listeners are in Canada. Do you ever work
right.
with anyone outside of the US?
Yes, so we have actually had three people currently. One is in Germany, and one is in Panama, and one is in the Bahamas. But they've all seen us at least once. And
Okay.
I think once they have seen it, and the amazing thing about technology and really the pandemic that showed us that we could provide equal quality of care just by having access to a screen. So we've been very successful managing the care, and we just ship the supplements as needed. Or the only thing is getting the prescriptions in terms of bioidentical hormones. And
Mm,
that's where two of these patients actually have some family here, and then they ship it to them. And one of them has her local provider just kind of write the prescription. She doesn't really care what she's writing. She's just like, well, as long as it seems safe, and I'm happy to partner with you.
okay. Okay, that's great to have some other options for people. So people can find you on your website. Are you on social media at all?
Yes, we have an Instagram handle called at Sayana Medical, Sayana Medical. And Sayana, why I call the practice Sayana, because Sayana in Sanskrit means being your guide. And I just thought it was so appropriate to what I want to do and what my practice stands for. Or you can go to our website at sayanamedical.com
Mhm.
and you can read about us and contact us directly through there.
Thank you so much for being here today, Shilpa, and shedding some light on this big mystery of women's hormones in perimenopause and menopause. So I love the work that you're doing. Thank you so much for that and for being a guest on Wellness by Design today.
Thank you so much. I love being here.
And thanks to everyone watching and listening. And maybe you want to go back and take some notes like I'm going to do. And reach out to Shilpa if you've got, if you want to do that quiz or try that detox. And you
Absolutely.
never
And we
know.
have free webinars every month, like listen in, see if that makes sense to you. So at least you're getting more educated and aware.
There you go. Beautiful. Lots of resources for you. So I hope you have a wonderful day, and we'll see you again on the next edition of Wellness by Design.
Thank you.